Hi friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss few mock questions from the CPC examinations. Okay, in combination in combined with CPT and ICD both. Whatever we have learned, we'll be discussing it today. Okay, so let's go to the questions one by one. So let's move to the first question. A 52-year-old female has a mass growing on her right flank for several years. It has finally gotten significantly larger and is beginning to bother her. She is brought to the operating room for definitive excision. An incision was made directly overlying the mass. The mass was down into the subcutaneous tissue and the surgeon encountered a well-encapsulated lipoma, approximately 4 centimeters. This was excised primarily bluntly with a few attachments divided with electrocautery. What codes are reported? So, what the patient has come for what and what procedure has been done? What is the diagnosis? Okay, the patient was having right flank pain for several years, and then she came for the she was having right flank pain with a growing mass. So now she came for removing of that mass. So that mass it represents it will be a benign lesion, right? Since there is ICD code also mentioned there, okay, we need to report the ICD code also. D ICD code, it will comes under neoplasm. So this will be under neoplasm, but this is not a malignant one. This is just a benign lesion, small lesion. So we have to code for the benign lesion ICD code. But what is the diagnosis that doctor has encountered? The surgeon encountered a well-encapsulated lipoma, approximately 4 centimeters. So lipoma, that is the diagnosis. Lipoma of which part? The patient was having flank pain, right flank pain. So flank will come in the trunk area, right? Trunk area. So let's go with the diagnosis first. Let's check which diagnosis to be coded first. We have 3 different diagnoses mentioned there. D17.9, D17.1 and R19.09. So let's look which code will be suitable. What is D17.9? You can open the ICD book. Okay, go to D17.9. What does it represent? D17.9 represents benign lipomatous neoplasm unspecified. This is not unspecified. There is a specific place, like area is mentioned there, right? The site is mentioned, anatomical site is mentioned as right flank pain. So let's go to D17.1. What is D17.1? Benign lipomatous neoplasm of skin and subcutaneous tissue of trunk. Yes, this is the trunk. So this will be the correct ICD code, D17.1, because this is a benign and lipomatous neoplasm of trunk. So our ICD code will be D17.1. So our answer will be either option B or C. Okay, I am just explaining you in this way because it will be easy for you to pass the examination. So it will save more time. So just skip options A and D. Now we have options B and C, because we know the correct diagnosis is D17.1. Now, what is the CPT code? What is the procedure performed here? Excision was performed. The mass was down into the subcutaneous tissue and excision was performed. So in that subcutaneous tissue, the excision is performed, right? And the size is approximately 4 centimeters. So we have to check for that subcutaneous tissue excision with size 4 centimeter. So what is CPT code 21935? You can open the CPT code book. Code 21935 and code 21931. It will be either of these two, right? Okay. So what is 21935? 21935 represents radical resection of tumor, soft tissue of back or flank less than 5 centimeter. This is less than 5 centimeter, but it's not a radical resection of tumor. This is excision. So what is the code 21931? Option C. Excision, tumor, soft tissue of back or flank, subcutaneous, 3 centimeter or greater. 21931 is 3 centimeter or greater. So size is correct. And the description is excision of the tumor. So our procedure is excision itself, right? So we got the correct answer as option C, 21931. That is for excision of the tumor greater than 3 centimeter. And then ICD code D17.1, benign neoplasm of the tissue of the trunk. Okay, so that's how you need to check the correct answer option. Okay, so the answer will be option C. So let's go to the second question. A 42-year-old patient with renal pelvis cancer receives general anesthesia for a laparoscopic radical nephrectomy. The patient has controlled type 2 diabetes, otherwise no other comorbidities. What is the correct CPT and ICD-10 code for the anesthesia services? So here we have to code for the anesthesia for laparoscopic radical nephrectomy, and then diagnosis. First let's check what are the diagnoses. Okay, the patient is having type 2 controlled diabetes, so it will be E11.9. Only one diagnosis is mentioned for DM, that is E11.9. So it will be the same, type 2 diabetes unspecified. Okay, now but we have to code for the cancer, right? The patient was having renal pelvis cancer, so the patient is already having a pelvis cancer. So for that he receives general anesthesia for laparoscopic radical nephrectomy. So we have to always first code for the cancer, then followed by any other disease, because here it is mentioned patient was having DM, type 2 DM, but controlled DM. So first we have to code for the cancer code, then 11.9. Now if you can see each and every option, there is physical status modifier mentioned. See, this question is very easy to understand, answer, because you can check it with the physical status modifier. P1, P3 and P2 is mentioned there, right? What is P1 physical status modifier? P1 represents a normal healthy patient. This is not a normal healthy patient. P2 represents patient with a mild systemic disease. Yes, we can say it is a mild systemic disease. Now what does P3 represents? Severe systemic disease. This is not a severe systemic disease, because patient is having type 2 diabetes controlled and no other comorbidities. It's clearly mentioned there, no other comorbidities. So this is not a severe systemic disease. This will be a patient with a mild systemic disease. Okay, so physical status modifier will be P2. So we can go for options C and D, P2. Okay, so what is there in option C? 00862. What is 00862? 00862 CPT code, the anesthesia code 00862 represents anesthesia for extra peritoneal procedures in lower abdomen, renal procedures including upper 1/3 of ureter. Yeah, this is the anesthesia for renal procedure, right? What is 00868? Option D. 868 represents renal transplant. There is no renal transplant mentioned here in the question. So our answer will be option C. But still look for one more code which is mentioned in option C, the diagnosis code. C65.9. What is C65.9? Just always cross check. Even though you got the answer in the like the correct option, if there are few more codes in the same option, in the answer that you have that you encountered, If there are few more codes mentioned there, you have to always check all the codes, okay, if there is any discrepancy. So check the the first diagnosis, C65.9. What is C65.9? Malignant neoplasm of unspecified renal pelvis. Yes, this is unspecified only because they just mentioned it's renal pelvis. The proper site is not mentioned, only renal pelvis is mentioned, right? And this is a malignant. That is why patient came for like nephrectomy procedure to receive the anesthesia, but still the procedure is nephrectomy, right? So this will be malignant. So malignant neoplasm of unspecified renal pelvis. So our answer will be option C, 00862 for the anesthesia code with P2 modifier, patient with mild systemic disease. C65.9, malignant neoplasm of unspecified renal pelvis, and E11.9, it's type 2 DM. Okay, so answer is option C. Now let's go to the third question. Preoperative diagnosis, multi-vessel coronary artery disease. So that is a preoperative diagnosis, okay, multi-vessel CAD. Post-operative diagnosis, multi-vessel coronary artery disease. So after the operation also the physician concluded the diagnosis as same, multi-vessel CAD. Name of the procedure, coronary artery bypass graft times 3, left internal mammary artery to the LAD. LAD means left anterior descending artery. Okay, sometimes they will mention only LAD. So just note down, you can note the abbreviation of LAD, left anterior descending artery. Saphenous vein graft to the obtuse marginal, saphenous vein graft to the diagonal. So this is the procedure, coronary artery bypass graft, where all the grafting has been done. Okay. Now the patient is placed on heart and lung bypass during the procedure. The anesthesiologist has prepared the patient for anesthesia at 6 p.m. The surgery starts at 6:15 p.m. and ends at 11:30 p.m. The patient is sent to recovery at 12 a.m. What is the correct anesthesia code and anesthesia time? So here we don't have to code any diagnosis. Here the question is, what is the correct anesthesia code and anesthesia time? Anesthesia code and anesthesia time. How will you calculate anesthesia time? When I had taken the anesthesia chapter, it was mentioned there how to calculate anesthesia time. Okay, so here the anesthesiologist has prepared the patient for anesthesia at 6 p.m. So the anesthesia time starts at 6 p.m. Okay, even though the surgery starts at 6:15, anesthesia was given at 6 o'clock. So anesthesia time starts at 6 o'clock. Now surgery ends at 11:30 p.m. and patient is sent to recovery at 12 a.m. So how will you calculate the anesthesia time? Anesthesia time, it's not the end of the surgery time, but the anesthesia time will be always begins with the anesthesiologist prepare the patient for anesthesia till the patient has been sent to the recovery. So here the patient was sent to recovery at 12 a.m. So the anesthesia time will be starting from 6 p.m. to 12 a.m. So what will be the time? 6 hours. See, in other two options it's mentioned 6 hours, two options it's mentioned 5 hours and 30 minutes to make you getting confused. Okay, because the surgery, that 5 hour 30 minutes is the surgery time starting like the anesthesia starting 6 o'clock and ends at 11:30. Surgery ends at 11:30. So sometimes few people will think anesthesia starts at 6, surgery ends at 11:30. So it means anesthesia will also end. No, it's not like that. Okay, if the surgery finished at 11:30 till patient sent for recovery, we have to check the time for anesthesia. That is very important. You will definitely get one question regarding anesthesia time in an exam, in the exam. Okay, so our anesthesia time we got as 6 hours. So the answer will be either option A or B. Anyway, let's move to the anesthesia code. That is also only two codes are mentioned here, 00566 or 567. Let's see what these options are. Okay, 00567. What is 00567? 567 represents anesthesia for direct coronary artery bypass grafting with pump oxygenator, and 00566 represents anesthesia for direct coronary artery bypass grafting without pump oxygenator. So here also people will get confused. It's nothing mentioned directly in the question as if it is with pump oxygenator or without pump oxygenator, right? But you should read the question carefully and check what all grafting has been done. It's mentioned there, coronary artery bypass grafting, 3 means 3 graft, left internal mammary artery, saphenous vein graft to obtuse marginal, saphenous vein graft to the diagonal. See here, saphenous vein is mentioned. Saphenous vein carries oxygenated blood. So this will be with pump oxygenator. If it is only artery, if there is no saphenous vein mentioned in the question, like for example, if it is the first two only, coronary artery bypass graft and left internal mammary artery to the LAD, then it will be without pump oxygenator. But now saphenous vein graft is also mentioned here. So this will be with pump oxygenator. Okay. So with pump oxygenator, code is 00567. So our answer will be option A, 00567, and anesthesia time 6 hours. Now let's move to the fourth question. This is the fourth question. See, if there is a question like this, like a story, don't get panic. Okay, you can just go through the question. All the things you will be getting initially, what procedure was done, what diagnosis is encountered, all those you will get initially itself, and how that procedure was done, that will be the description below. But we need that description also sometimes. Okay. So anyway, let's move to the question. Operative report. This is the operative report. What is a pre-operative diagnosis? Pre-operative diagnosis, possible basal cell carcinoma. It was only a query. But what is a post-operative diagnosis? The doctor confirmed that it is basal cell carcinoma. That's how you need to understand from pre-operative diagnosis and post-operative diagnosis. Always check for post-operative diagnosis because that is the confirmed diagnosis. Okay. So here post-operative diagnosis is basal cell carcinoma. So we have to code the diagnosis for basal cell carcinoma. Now, so that will be the diagnosis. Okay. Now what about the procedure? Procedure performed. Excision lesion 4.3 cm into 2 cm left thigh. FTSG from calf to thigh. Anesthesia general by LMA. That is the anesthesia medicine name given. So what is the procedure here? Excision of left thigh, and the size is also mentioned. So anyway, let's move to the description. Description of procedure. After undergoing adequate general anesthesia and dura prepping the left thigh and draping with cloth towels and drapes, 0.25% marcaine with epinephrine, total of 30 cc was used to anesthetize the skin. So this is how the anesthesia was given. That's what written there. A lesion slightly over 4 cm was observed on the patient's left thigh. A small portion was removed and sent for frozen section analysis. This returned basal cell carcinoma. So this is how the doctor diagnosed it as basal cell carcinoma. Initially 4 cm lesion was observed on the patient's left thigh. So from that a small portion has been removed and sent for frozen section analysis. Then the doctor confirmed the diagnosis as basal cell carcinoma. Per prior consent, we removed the remaining lesion with a 0.75 centimeter surrounding margin. So again from the balance lesion, initially the doctor was removed only a small portion, right? So from the balance, again the doctor has removed 0.75. Due to size and location of this lesion, the decision was made to harvest a full thickness skin graft from his left lower leg. So due to the size and location of the lesion, again the decision of the doctor was made to do a full thickness skin graft. So he decided to do a full thickness skin graft on the left lower leg, because initially it was on the thigh only. Now from his left lower leg he is going to do a skin grafting, full thickness skin grafting. Lower leg was prepped and draped and 0.25% margin was injected. So again the procedure is being repeated. Excision of 5 cm into 5 cm, full thickness graft was obtained and placed on back table for prep. So excision of full thickness graft, size is 5 cm into 5 cm was done. We returned to the thigh area. Again the doctor went to the thigh area. All edges were trimmed and the graft was placed into the defect and sewn with a running 30 vicryl. Means it is sutured with that medicine, vicryl medicine. That graft has been placed onto the thigh area. The skin edges, the skin edges were approximated with a running subcuticular 40 vicryl and further sealed with a derma bond. All this just explanation only. Hemostasis was well controlled, means there is no bleeding. Okay, the wound was irrigated with a normal saline. What procedure and diagnosis codes are reported? So here, what is the diagnosis? First, let's look into the diagnosis. We already got the diagnosis as basal cell carcinoma, right? So let's check what are the diagnoses given in the options. Only two are given: C44.719 and C76.52. So let's see which is basal cell carcinoma. So go to ICD book, C44.719. What is C44.719? Basal cell carcinoma of skin of left lower limb including hip. Yes, this is basal cell carcinoma. Still just check what is C76.52. C76.52 is malignant neoplasm of left lower limb. No, this is basal cell carcinoma only. So we got the diagnosis as C44.719, which is there in options A and B only. So we can directly skip options C and D because C and D diagnosis is incorrect. So let's check the CPT code book, the procedures one by one from options A and B. Okay. Okay, go to the first option. What is CPT 11406? 11, just take option like the first code 11406. 11406 represents excision of benign lesion including margins except skin tag, trunk, arms or legs, excised diameter over 4 cm. Yes, we have an excision 4.3 into 2 cm. Okay, but here it's written excision of benign lesion including margins. Anyway, let's see the other options also. What is the second code? 15770. What is 15770? Because we have three procedures here, right? Initially, excision of left thigh. Okay, and then so initially excision of left thigh, and then what the doctor has done, again a sample from the like grafting has been done. Okay, grafting has been done, and then 0.75 centimeter before doing the grafting, 0.75 centimeter excision was also done. So just take the second code 15770. What is 15770? Graft. Derma fat fascia. Grafting derma fat fascia. There is nothing mentioned like derma fat fascia, facial grafting. No, this is grafting from the left lower leg, right? So just skip option A. Let's check what is option B. See, if you have found one CPT code incorrect, don't go with that. Just check the other option. Okay. And if it comes right, if all the code comes right, then that will be the answer. So what is in option B? 11606. What is 11606? 11606 represents excision malignant lesion, including margins, trunk, arms or legs. Excised diameter over 4 cm. Yes, this is 4 cm. This is a malignant lesion. Basal cell carcinoma is a kind of malignant only, but still let's check the other codes, other CPT codes. What is 15220? Code 15220. Open the CPT code book and go to the code 15220. Full thickness graft. Yes, this is full thickness graft, right? Free, including direct closure of donor site, scalp, arms and or legs. 15220. 20 square centimeter or less. Here how much excision was made for the full thickness graft? 5 centimeter into 5 centimeter. It means 5 into 5, 25 square centimeter. So here in the question it is 15220 is 20 square centimeter or less, and what is 15221? Each additional 20 square centimeter or part thereof. So we have to code both, right? 15220 and 15221, because 15220 represents full thickness graft up to square centimeter. 20 square centimeter or less means up to 20 square centimeter. But our full thickness graft is 25 square centimeter. So up to 20 square centimeter we have to code this, and then on the next code, add-on code 15221, it's clearly mentioned each additional 20 square centimeter or part thereof. So it can be each additional 20 it can be 20 square centimeter or a part of. If there is nothing mentioned like or part of, then we cannot use that code. Okay, but here it's clearly mentioned or part thereof. So, and also down in that code down in the bracket it's mentioned use 15221 in conjunction with 15220. So since our excision diameter is 25 square centimeter, we have to use both the codes for the grafting. So we got the answer, right? The answer will be option B, 11606 for the excision malignant lesion, 15220 for and 15221 for the full thickness graft of 25 square centimeter. So 20 square centimeter, and then each additional square centimeter, 20 square centimeter or part of. And then our diagnosis, basal cell carcinoma of the left lower leg. Okay, so this is how you can find out the answer for this big questions. Don't ever skip big questions thinking that it is hard to find out the answer. No, it will take some time, maybe 5 minutes or like that, 5 to like 7 minutes hardly, but the answer will be easy to find out. Okay, anyway, let's move to other question. Now let's check one more question. A 29-year-old female in the hospital who has AIDS has been put on a ventilator due to her weakness and dyspnea. The physician suspects she has pneumonia and performs a thoracoscopy. The contents of the chest cavity are inspected with an endoscope and multiple nodules are seen in the right lung and biopsied. Pneumocystis carinii pneumonia is diagnosed. What CPT and ICD-10 codes are reported? So here what is the diagnosis? The patient is already having AIDS. So it means HIV code we have to use. Okay, patient is having HIV. And then what is the diagnosis that was confirmed after the procedure? Pneumocystis carinii, pneumonia. Now what is the, so these two will be the diagnosis. You have to code for the AIDS, HIV code, and then pneumocystitis. Okay. And what is the procedure performed here? Contents of chest cavity are inspected with the endoscope and multiple, okay, thoracoscopy. The physician suspects she has pneumonia and performs a thoracoscopy. So thoracoscopy procedure is being done here. And right lung and biopsy is also mentioned. So it means biopsy is performed. So anyway, let's check the ICD code first. Okay. Since HIV is present, you have to code for HIV. What is the code for HIV? B20. B20 is the code for HIV. And if you can check option C, what is Z21? Z21 means asymptomatic HIV. Here patient is already having AIDS, clearly mentioned. So this is not asymptomatic. So you can skip option C. You should have the ICD code B20 in your answer because it is an HIV patient. So you can skip option A also since there is no B20 there. So we have two options remaining, option B and D. Okay. So let's go to option B. Diagnosis B20 is for HIV. What is B59 diagnosis? If you can take B59 option, that means pneumocystitis, which was a confirmed diagnosis, pneumocystitis. So B20 and B59 we have to code. But that both the ICDs are there in option B and D. So we have to check for the CPT. And one more thing, for a confirmed HIV patient coming for some other procedure, but I mean that diagnosis is not confirmed, right? Like after the procedure only the diagnosis was confirmed. So it was already an HIV patient. So you have to code HIV first, HIV code first, B20, followed by the confirmed diagnosis code. So here B20, B59 should come. Still, we will check the CPT codes. What is the code 32608 in option B? 32608. Thoracoscopy, yes, that is a procedure done, right, with biopsy. Thoracoscopy with diagnostic biopsies of lung nodule or mass, unilateral. Yes, this is thoracoscopy of lung, right lung, unilateral only right lung is biopsied. So this will be the answer, but still we have only one more code left in option D. Let's check that also. Anyway, that will not be the answer because B59 is the ICD code which is mentioned first. Still, let's see what is 32650. What is 32650? Thoracoscopy surgical with the pleurodesis. No, this is not pleurodesis, this is with the biopsy. So our answer will be option B. 32608 for the thoracoscopy with biopsy. B20 means HIV and B59 for the pneumocystitis. Diagnosis confirmed. Okay. So this is how you need to check. So friends, these are few questions. I had discussed 5 questions from the CPC examination. So we will be moving with like short question, like small number of questions, because it will be easy for you to learn. It will be easy for you to understand, think and answer. Okay. So that's why I am putting like small number of questions. Otherwise the video also will, the length also will be more. You will get bored also. So in the next episode, we will conduct more practice questions. So if you have any queries regarding these questions, anything in related to the answer or any queries, you can mention it in the comments and I will be replying back to it soon. So if you are new to the channel, please support me, please subscribe, please like and share my video. Thank you so much. See you soon in the next episode. Stay tuned. Bye.